Hi everyone, welcome back to my YouTube channel, and today we are going to talk about lesions of recurrent laryngeal nerve. So let's start our topic with introduction. Recurrent laryngeal nerve is a branch of vagus nerve that is 10th cranial nerve and plays a vital role in voice production, breathing and airway protection. It supplies all intrinsic muscles of larynx except the cricothyroid muscle and provides sensory innervation below the vocal cord. Lesion of this nerve can cause hoarseness, voice loss, breathing difficulty, or life threatening airway obstruction depending on whether the damage is unilateral or bilateral. Anatomy overview. Origin and course of the recurrent laryngeal nerve. Right recurrent laryngeal nerve loops around the subclavian artery and ascend in the tracheopharyngeal groove, while left recurrent laryngeal nerve loops around the arch of aorta near the ligamentum arteriosum, then ascends in the tracheoesophageal groove. Both nerves enter the larynx behind the cricothyroid joint. A function of recurrent laryngeal nerve, it has motor function as it supplies all intrinsic laryngeal muscle except for the cricothyroid, which is supplied by external branch of superior laryngeal nerve. It also has sensory function as it supplies the mucosa of larynx below the vocal cord, trachea, and also it supplies the mucosa of trachea and mucosa of esophagus. Causes of recurrent laryngeal nerve lesion. First is surgical injury that is common during thyroidectomy, parathyroid surgery, or neck dissection. Second cause is tumor or masses as lung apex, that is Pancoast tumor, and medicinal tumors or thyroid cancer can affect recurrent laryngeal nerve or can cause recurrent laryngeal nerve lesions. Third cause is aortic arch aneurysm as it compresses the left recurrent laryngeal nerve. Fourth cause is trauma as penetrating or blunt trauma causing neck injuries can cause recurrent laryngeal nerve lesions. Next cause is neurological disorders that may be brainstem or vagus nerve lesions. Effects of recurrent laryngeal nerve lesions. If there is unilateral lesion, it can cause vocal cord position, that is paralyzed vocal cord that lies in the paramedian position, not in the median position. It can affect voice, it can cause voice to be hoarseness, weak voice, or breathy speech. It can affect airway that is usually adequate and there is no major breathing difficulty. It can compensation as the opposite vocal cord may cross the midline over time, improving voice quality if the lesion is unilateral. But when there is bilateral recurrent laryngeal nerve lesion, it can cause vocal cord position that both vocal cords lie in the paramedian position. The voice is severe impairment or aphonia, that is loss of voice may happen. There is serious narrowing of rhinoglotitis that lead to stridor and respiratory distress that may require emergency tracheostomy. Clinical signs and symptoms. There is hoarseness or breathy voice, weak or absent cough reflex. There is aspiration risk due to incomplete glottic closure and stridor or dyspnea, especially in bilateral lesion. And there is loss of sensation in larynx below vocal cords if sensitive fibers are involved. Diagnosis of recurrent laryngeal nerve lesion. First we do is laryngoscopy that show immobile vocal cords in the paramedian position. Second we can do is imaging, that is maybe CT or MRI to detect tumors, aneurysms or nerve compression. Third we can do is voice analysis, that is to evaluate quality and pitch changes of the voice. Management of recurrent laryngeal nerve lesion. First we do is voice therapy, that is for mild unilateral paralysis. We can do surgical intervention, that is medialization, thyroplasty or injecting laryngoplasty to improve cord closure. Tracheostomy for airway obstruction in bilateral lesion is done. And treatment of underlying cause as tumor removal, aneurysm repair or nerve decompression is the mainstay of the management of recurrent laryngeal nerve lesions. Clinical significance. If there is left recurrent laryngeal nerve vulnerability, its long course in the thorax make it prone to injury from medicinal pathology. Iatrogenic injury, it is most frequent complication of thyroid surgery. It can cause high vagal lesion if recurrent laryngeal nerve is damaged proximally with the vagus nerve. Superior laryngeal nerve involvement leads to combined voice and pitch problems. Conclusion of this lecture video. Lesions of recurrent laryngeal nerve can profoundly impact phonation, breathing, and airway protection. Unilateral lesions primarily cause hoarseness, whereas bilateral lesions are life-threatening due to airway compromise. Understanding its anatomy, causes, and clinical effect is crucial for safe surgical practice and prompt management of airway emergencies. And this was all about recurrent laryngeal nerve lesions. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.